Hello, everyone who's joining. We're just going to give it a few minutes or a couple of minutes just for people to join. If you could just try and leave a message in the chat just to see if you can hear us okay. Oh, lovely. Thank you. We're not that technical, so we do have to ask to check to make sure that people can hear us okay.
I'm definitely not technical at all.
Okay, so it's been a couple of minutes. I think we'll get started. So we are here to talk to you today about the ARES mesotherapy and the One Need device. And my name's Dr. Helen Whyte, and this is Rachel Davison, and we are coming to you from the aesthetic training rooms in Newcastle upon Tyne. Also behind us, you can see the aesthetic treatment rooms as well. So let's just check everything's plugged in then. Here we go. So there are a couple of discounts on at the moment with Shop Beautiful. So they are giving 25% discount on the One Need device, which also includes a box of cartridges worth £150 and a free gift with the code NEED25. And with the ARES 30 code, they're giving you a 30% discount on the ARES range as well. So it is a good discount, worth making a note of. So who are we? My name is Dr. Helen Whyte. I'm a dentist. I own the aesthetic treatment rooms and the aesthetic training rooms with Rachel. I've been a dentist. I've been qualified for about 17 years. We've had the clinic for just over 2 years together. I'm still a practicing dentist. I still do 1 day a week. And I think we're just COVID, I think a lot of people will relate, or just wanted to make a bit of a change with things.
So my name is Rachel Davison. I'm a dental therapist. I've worked in dentistry for around 20 years now. And as Helen said, we started doing aesthetics and opened this clinic 2 years ago. So we both co-own the aesthetic treatment rooms and we both co-own the aesthetic training rooms as well. So we've partnered with Shop Beautiful and MedFX to provide some training for them. So welcome to our webinar.
Here we are. So this webinar, what we want to cover, briefly going to cover microneedling, what it is, what it does, and then talk a bit more about the One Need device and the One Need accessories and cartridges and things that come alongside that. Cover a bit more about mesotherapy again, what it is, what it does, and then we'll talk a bit more about the ARES mesotherapy solutions, what's in those, and what the indications are for treatment with those, and show you some of our results that we've had whilst using these. So first, if we talk about the microneedling with the One Need device, which is produced by Campomats. Campomats is an Italian company, so it was founded in 2019, so it is quite a relatively young company. So if we talk about microneedling, because this is really what this device is for, it is a form of collagen induction therapy. So collagen induction therapy being a cosmetic procedure that involves repeatedly puncturing the skin with tiny sterile needles. It stimulates the fibroblasts to produce and promote collagen and elastin deposition in the dermis, so just below the surface of the skin. It is a minimally invasive technique and it's used to treat different skin pathologies. So it creates transient microneedle channels in the skin and it facilitates the transport of therapeutic molecules into the epidermis, and this is generally the main obstruction to the penetration of the active ingredients. So It's mainly used to improve the appearance and condition of skin. So it's used to rejuvenate skin, to tighten skin, and to remodel scars. There's three main different methods of microneedling, of stamps, rollers, and motorized devices. There is a plethora of all of these out there. So with stamps, you're looking at something like Wow Fusion, where you can actually put the microneedling, the mesotherapy solution inside the microneedling stamp and then use that in the skin. Rollers, which I'm sure many people have seen, which are just little rollers that are sort of embedded with needles which go over the skin, and then motorized devices. And there are a lot of motorized devices out there. It is difficult to know what to choose from. We've also got, you can see in the diagram there, the difference between microneedling and nanoneedling. So nanoneedling can also be called aesthetic micropricking. It's used just the same as microneedling, but only up to a 0.3 millimeter depth. It is much less invasive, but we can talk a bit more about that later on. It's a minimally invasive technique that relies on skin repair following your microtrauma to your patients. So they're not going to see instant results. They're going to be quite red. Their skin's going to be quite inflamed afterwards. And it's going to take time for the skin to turn over and remodel. The patients are going to likely need a course of treatment to see significant improvement if they have got something that they are specifically concerned about. Obviously, if it's just a bit of a refresh and a bit of a glow they're looking for, then a one-off treatment may be suitable for that or for maintenance, but generally you're probably looking at a course of treatment. So microneedling depths, what we need to consider is the thickness of the skin, your desired outcomes, and the areas being treated. So for example, if we look at the thickness of the skin, round the eyes is very fragile, delicate skin. We're never going to microneedle more than probably about 0.25 millimeters around there. And the upper lip is very similar. It just depends on the thickness of the skin. So it may be up to 0.5. If you look at cheeks, chin, 0.5 to 1 millimeter. Scars, they've got thicker tissue, so probably looking at a little bit thicker again. So, 1 to 1.5 millimeter on the face. If it's on the body, possibly up to 2 millimeters. And again, those depths are going to vary depending if someone's got compromised skin, what you're treating as well, and just kind of generally that person's skin type. You need to assess every patient as it comes through. So the One Need pen also has different speed settings, and most treatments you're looking at probably 3, 4 out of 6 unless the skin is compromised or fragile. So indications for microneedling, what are we actually looking at treating? So we are looking at convey and absorption of active substances. So it creates these microchannels, which helps to facilitate the transport of these therapeutic molecules into the epidermis. It basically overcomes the barrier of the skin to allow those medicated molecules to get through. We're looking at toning and rejuvenation of the skin, blemishes and hyperpigmentation, improvement of acne scarring, improvement of expression lines, to stimulate cell renewal and collagen formation, general anti-aging, to stimulate hair growth, for anti-cellulite treatment, for stretch mark treatment, and for treatment of the eye area as well. So the contraindications for microneedling, what are we not going to be using it for? Pregnancy and breastfeeding. So this is a common one. Generally, these techniques, especially with mesotherapy, are never going to be tested on someone who's pregnant or breastfeeding. It would be unethical. There's obviously, if there was a risk to the baby, risk to the mother, it wouldn't be ethical to try it. So generally, most things, there's not a lot that's suitable for someone who's pregnant or breastfeeding. Open wounds, again, we're not going to damage already sort of damaged, traumatized skin. Wait until that's healed. Active herpes, active infection, active acne, we're going to avoid those conditions. If you're putting a needle through anywhere where there is infection and then putting it somewhere else in the skin, you're just going to spread the infection. So that needs to be resolved first. Suspected skin cancer, again, at best, we're going to be stimulating blood flow to that area and increasing growth. At worst, there's a possibility that you may spread it, which is obviously not great. So anything that you are concerned about like that, patient goes to the GP. Autoimmune diseases and uncontrolled diabetes. This is something that, again, these people have got compromised healing. So they cannot heal very well after trauma to their skin. Again, it may be not the treatment for them. Bleeding disorders, goes without saying, you put needles in someone, they're more likely to bleed. Moderate to severe skin disorders, things like, severe eczema, psoriasis, it's not going to be suitable for those type of patients. And if they've had aesthetic treatments within 2 weeks, purely for the fact that if we're looking at someone who's had, Botox a week ago and they end up with a complication after you've done your microneedling and mesotherapy, it could be that they end up with a complication that you're not sure where it comes from. So let everything settle down either side when you're doing treatment like this. So the One Need device by Campomats. As I say, they're a young company founded in 2019. Both the co-founders had significant experience in the field of needling and medical and aesthetic micropigmentation equipment. So they noticed how many machines on the market were old and obsolete, and they were often without the necessary, easy for me to say, often without the necessary medical certification. So they wanted to create functional and beautifully designed devices for micropigmentation, needling and radio frequency. And they wanted to bring beauty into their products and to their customers with products that are obviously safe to use. So they combined their made in Italy design with the skills of their team with the best technology available. And they focused their machines on the people who are actually using them, so people like us. This is just a little video about their device.
It's a very attractive device.
It is. So it's quite a stylish device. It is one of the very few hand pieces or devices in the world to have the CE medical certificate for microneedling and microdermabrasion treatments. So it is quite an exclusive medical device. It's a CE class 2B. You can use it either wireless or wired, so it is rechargeable. However, if you're like me and forget to charge stuff, it is also helpful when you can plug stuff in. It can hold the charge for a couple of hours. So you know that we don't actually use the microneedling pen for all that long, so it can equate to quite a lot of treatments without recharging in between. And it has a performance deep double scale system, which you can see on the bevel on the pen as well, which means that you can adjust the depth of your treatment with absolute precision. And as I say, you could see in the video that it actually helps to set the working depth precisely for the micro pricking, microneedling and the nano peel treatments. So you can provide many treatments with it. And it is quite a quiet device as well. It doesn't make a great deal of noise.
Yeah, that is quite good because some of them are quite loud, aren't they?
Yeah, they are. Some of them can be quite noisy, which is off-putting for you and for the patient sometimes as well. So this is actually how the One Need device comes along. So you could see that the One Need device comes with a convenient carry case. It's aluminium, it's lightweight. It also has the ID number for the microneedling device on it as well. But it's actually really good for those of you who are mobile or who work at different clinics, that you don't have to worry about it getting battered because it's already conveniently cased in this. The handpiece itself is also lightweight aluminium, and it's a sealed unit, so it means that no bodily fluids can enter the device and create cross-contamination. It is actually also calibrated, which means that it's a sort of repeatable results every single time, which is really important for a medical device as well. The medical device is a CE medical power supply for recharging the lithium battery. It's got a 5-volt motor, which means, as I say, it can be used wired or wireless. The stand is just made from white polymer, so it can be easily disinfected. It's got a screw and cartridge, which is their easy lock system. So the cartridges are really easy to change. They're literally just screw in. I don't know if you saw as well looking at the video, but the cartridges have all got like almost like a silicone bung at the end over the needle points. So everything's kind of stabilized in those cartridges, and you just take that off when you're ready to use it as well. It's just an extra safety against any kind of accidents as well. All the cartridges are single use as well. And you can obviously put a cross-infection plastic sleeve over the top of it. So the One Need device itself can work at 6 different intensity levels and can mount different types of cartridges. And the different cartridges can be used for medical microneedling, micro pricking, and microdermabrasion or nano peelings, and a single microneedle. As I say, they use surgical steel and biocompatible plastic materials. All the cartridges are disposable and they're individually packed in a sterile bag. They've all got their lot numbers on, they've all got their expiry date on, so we know that everything's as good as it should be. So if we go through the cartridges, the first one, if we go to, is the micro pricking cartridge. So this is the nano needling treatment. So it's ideal for non-invasive epidermal stimulation for gentle skin rejuvenation. It's good for patients who have very reactive or sensitive skin. So because it's only 0.3 millimeters in depth, it's good for those patients whose skin's a little bit compromised, maybe those rosacea sufferers, you know, and they're just a little bit more sensitive as well. We're not expected to see much bleeding with that because it is 0.3 millimeters. It's pretty non-invasive. As I say, the 9 needles, you can see I've set in this flower design. So we've got 6 needles around the outside, 3 needles in the middle, which means that it spreads the pressure and it makes it more comfortable. It still allows 97% of absorption of active ingredients from the mesotherapy serums, and it can be used in combination protocols with other active biostimulation substances as well. If we go on to the microneedling cartridge, so this is obviously indicated for microneedling treatments. We're going to probably get a bit more bleeding with this. So anything up to, you can use it for anything up to 2.5 millimeters. I mean, there might not be that much that you want to use for 2.5 millimeters, but you can if you need to. And as I say, with the flower design, it does help to spread the intensity. It distributes the pressure. It makes it a bit more comfortable. Good for treatment with scars as well. And you are going to find that with the more invasive epidermal stimulation, with the bleeding, you're going to get fibroblast rupture. You're going to get a deeper skin rejuvenation. It's going to take your patients longer to recover from this one. So if you're doing microneedling, it's going to take maybe 4 to 6 weeks in between appointments. If you're doing a deeper microneedle, yeah. For the sort of aesthetic micro pricking, you may be just looking at 2 to 3 weeks in between treatments, depending on how their skin reacts to it as well. Again, this is the microdermabrasion cartridge. Now, this is something new using, well, it was to us using a microneedling device for microdermabrasion. So we've actually got this video for you as well, and it's using some of the One Need Pro line range as well, so you can see some of those products in action. So this is indicated for, as I say, the microdermabrasion and the deep scrub treatments. It's got 130 round nano points in the cartridge, and it's for use with the peels and active scrub substances. So this is all done with Campermat's Proline range. So it's just a little sort of view of their products and what they can do with their protocols as well. So the next cartridge we've got is for targeted treatment. So this is really developed for the treatment of scars. It's just a single needle in the cartridge, and it's really is just for advanced treatments only. So if I just tell you a little bit more about their Proline range that One Need do. So they have their own microneedling, micropricking and nanopeel working protocol. The products are all natural, organic and cosmeceutical grade products. They use a high concentration of organic aloe vera in each product, and each formulation has strong, soothing, calming and anti-aging properties. In addition to that, each product is going to have specific active ingredients that enhance the results. They've chosen not to include fragrances due to sort of avoiding irritation of skin. So it stops skin irritation and sensitization. So it's to try and make even the most sensitive skin tolerable to having these sort of treatments. So they do, you could see the sanitizing towels, which were disposable sanitizing pads that are enriched with functional substances like the organic aloe vera juice, saline solution, burdock extract, sage and green tea for a soothing and sanitizing action. They have their calming cream, which is rich in special peptide 15, which acts on hyperreactive and sensitive skin. It strongly increases the tolerance of the skin to make it less reactive, and it relieves the sensation of tingling, burning, or redness of the skin. The nano peel that you saw there being used, it's £110 for a box of 6, I think, of 4 mils. It has specific active ingredients of AHA, BHAs, and PHAs to help to combat blemishes, impurities, and wrinkles. They've got the mousse balance, which is designed for cleansing skin before and after all of those procedures. Again, it's got the aloe vera and propolis. And it's got moisturizing, soothing, and restorative action. You could see the masks at the end, which are disposable single-use masks in regenerating biocellulose. And again, we've got the organic aloe vera juice, peptide 15, licorice extract, and hyaluronic acid. So it's great for restoring the skin after treatments. Obviously, you've got the discount code for the pen, so get a bit of a discount on that. And the cartridges at the moment are £105 for 10, I think. So let's go on to the mesotherapy, the ARES range, where Rachel will tell us all about that.
Yeah, so yes, I'm going to go through the mesotherapy, the ARES range, which is a fantastic product. So mesotherapy is a technique that was invented in 1952 by
Dr. Michel Pistaud.
My French is I'm not good at impressions, really. That would have sounded terrible. So
I'm not sure it did sound great, but here we are.
So it's basically where the medication is injected into the mesoderm. So it's a layer of fat and connective tissue underneath the skin. So it's a technique using very small doses of medication. So it's administered in specific areas depending on the condition of the areas being treated. So there are different methods of administration. So the different methods: injection. So this is where mesotherapy, the solution is going to be injected exactly where it needs to be. So that's really good for targeting specific areas. If you're going to use a mesotherapy solution in this technique, you're going to need to make sure that the whole product has been CE marked or FDA approved for injection. So as we like to say all the time, check with your insurance.
The insurance company are blacklisted us for making you phone them all the
time. Another method is electroporation. So only certain solutions can be used for this. So you need to check the guidelines and make sure that the solutions that you are using are okay to be used for electroporation. ARES is absolutely fine to be used for electroporation. The other technique would be microneedling. So this would be using a microneedling motorized pen, a stamp, or a roller. We like to use our 1-lead pen.
It's our favourite.
So that's what we do here traditionally.
Traditionally.
So ARES, what is it? It is basically mesotherapy cocktails. There's 4 different types. So the different ones that you can get are AA, which is anti-aging, AK, which is a dermal reconstructurant.
We're doing well with our pronunciations tonight, aren't we?
Really well. You could tell it's late. And we have AO, which is antioxidant, and HB, which is the hair booster. So, like I said, pre-mixed mesotherapy cocktails. When you buy these, you will get them in a box of 4. So in each box, you will have 4 vials of 4 mils of cocktail. So AA, this is for tired, aged skin. It helps with fine lines, wrinkles, age spots, and it generally rejuvenates the appearance of loose, sagging skin. It will also help circulation to the skin layers. So looking at the ingredients, we'll just briefly go through what the ingredients are and how they will help the skin. Hyaluronic acid, we have 3 different molecular weights, high and low. So the high hyaluronic acid will improve the performance of peptides and as well as the usual smoothing and moisturizing of skin. We have acetyl tetrapeptide, which contains the amino acids. We have pentapeptide, which is good for cellular proliferation, which will give you that like Botox-like effect.
Not Botox, but good to have that kind of likeness, isn't it?
Likeness. We also have orgipeptide. Now, this is something that would help with the luminosity and tone of your skin. Copper tripeptide, this elevates the production of vascular growth factors, so it helps from that point of view. Tripeptide increases collagen synthesis. Misotrol peptide enhances the skin repair and circulation. And then we have tetrapeptide. We are doing well on that. We'll make it earlier next time. So this is rich in the amino and fatty acids, as well as helping with sort of deeper penetration of the other ingredients. Next, we have AK, which is the dermal reconstructurant. So this helps moisturize and it also helps improve scars. It's a very good product. We like to use this one.
Yeah, it's a good one.
Probably one of my favorite things to do in here. Again, high hyaluronic acid, both high and low molecular weights. We have succinic acid, which is a metabolic intermediate, which will help facilitate in rejuvenation of skin, reduces oils, it will brighten. It's antioxidant, anti-inflammatory, and antibacterial.
Does everything.
Does it all.
All round that.
So it'll help protect your skin against free radicals, and it helps with skin cell turnover as well. Then we have the rest are basically amino acids. Now, amino acids, just the same as usual. It's going to improve elasticity. They are the building blocks of proteins in the skin. So they're going to help with things like improving wound healing, forming collagen. Obviously, collagen is very important in the skin because it acts as like a scaffold and helps sort of hold the skin in place. It helps with skin elasticity, skin regeneration. It's a buffering agent and it is also an antioxidant. So again, it's going to help protect from free radicals. Next, we have the AO, the antioxidant. So this brightens the skin. Again, it's a free radical scavenger, so it's going to help with that. It's going to help with anti-inflammatory products, and it'll help stimulate fibroblasts as well. So ingredients. In the antioxidant, we have again high and low weight, high hyaluronic acid. We have ferulic acid, which helps repair damaged skin cells. This will help neutralize free radicals and reduce like photoaging and protect from further damage from UVA or UVB. It will reduce the inflammation from sort of acne, hyperpigmentation, dermatitis, and increase the effect of vitamins A and C as well. It has eugenol in it, which is an anti-inflammatory. It has ascorbyl glucoside, which will brighten the skin. It has safranal. Now, safranal is again going to help protect against the UVA and UVB. And it's also going to increase the growth of skin cells. So it's going to help with healing wounds. It is a tyrosinase inhibitor.
Yeah,
we're doing it very well.
Tyrosinase, we're doing it.
Tyrosinase inhibitor. So it's going to obviously reduce pigmentation. It has curcumin, which is a derivative of turmeric, which is a powerful anti-inflammatory. So it's going to obviously act as an anti-inflammatory shock, and it's going to improve and maintain collagen and fibroblasts. Next, we have the hair booster. This reactivates damaged follicles by increasing the blood flow, the blood supply, and nutrients, which will help replace thin, weak hair with stronger, thicker hair. It can be used to treat things like hair loss, such as male and female pattern baldness, and some types of alopecia. So the ingredients in here, Again, high and low weight molecular hyaluronic acid. So we have things like vitamins, keratin, and ferrous gluconate, which all provide energy required to stimulate the growth of the hair. Then we have peptides, which are going to promote the hair growth, bulb stimulation, and follicle revitalization as well.
I'm glad you're not going to try and pronounce them peptides again.
Biotin is essential for the growth of healthy hair. So again, another brilliant ingredient to have in there. And then we have arginine. So arginine is good for increasing microcirculation to the bulb and the follicles. They are going to help strengthen the hair. So hyaluronic acid. The hyaluronic acid in all of the ARES has been CE marked. And that's in each of the mesotherapy cocktails. The products themselves are made by a company called CMed in Italy. Brilliant company. They always work to pharmaceutical standards. So they're making sure that they've got a top quality and safe product. So we do like their products. We use quite a lot of their products in our clinic. So how can it be used? So methods of delivery for the ARES, we would either use this with microneedling or electroporation. So as Helen's already gone through, microneedling is insertion of tiny sterile needles, which basically causes microtrauma and microchannels, which allows for the penetration of the larger particles of the products. Electroporation is needle-free and it uses electrical currents. So the protocol for use. You always want to cleanse and degrease the skin before you do any treatment. We always use Forever Prep because it has been made by the same company, same manufacturers. So we know that there are going to be no issues with interactions of ingredients and they work well together, complementing each other. So we'll always stick with using the same. You will want to disinfect the skin to kill any bacteria. You will then microneedle the entire face dry, and this is going to create the microchannels for the product to absorb into. Then you will apply your chosen cocktail. Then microneedle again for a whole 2 passes. Leave the product on for around 2 minutes and then apply aftercare. So for aftercare, we would use either BioRehydrate or BioRelift, as again, it's been made by CMed in Italy. So again, you're going to know that there's no issues with interactions of ingredients and they do work well complementing each other. Then you want to apply SPF. So doing this treatment, you're looking at, you can have a course of 4 or 5 treatments, 2 to 4 weeks apart. Now, this is dependent on how deep you're treating and how hydrated the skin is. So you would need to look at that from your consultation. But it can be repeated again 3 to 4 times a year.
Although if you do it 4 times a year, I think we're doing it every month, really, aren't we?
Yeah.
Might be a bit too often.
So electroporation. Now, electroporation is a technology that's been developed for like efficient and safe administration of intradermal drugs without needles. So it's really good for needle-phobic patients. Electroporation is based on a biological process which involves the temporary breakdown of cell membranes. So this is caused by high voltage pulses and oscillations, so that will break down the cell membrane and allow the substances to penetrate through the cell, basically, so it goes deep into the dermal layers. So electroporation or needle-free mesotherapy, whichever you want to call it, it's basically an advanced non-invasive treatment. So it's perfect for increasing plump, healthy appearance of skin, as well as soothing and hydrating treatments as well. So contraindications, precautions and medications. Again, similar to any other treatment, you always want to make sure that you've done a full comprehensive medical history. Now, these lists are just some things to be aware of. It's not limited to this.
It's not an exhaustive list of
No, you would look at this and straight away somebody would think, oh, well, you could add this on, you could add that on. So always refer back to your initial training for microneedling for your full comprehensive list, just to make sure that you are treating your patients safely and obviously protecting yourself as well. So like I say, this is not a limited list. So we're going to show you some of our treatment results that we've had here in our clinic. So before you do any treatment, you always need to make sure that you have full consent. So you don't only just need consent to do the treatment, but you also need consent for the photos. So pre and post-op photos you're going to need for insurance purposes. So make sure that you've got consent. Make sure that you've got consent before you share any of the images as well. So we're going to show you the results that we've had. Now, please be mindful that our patients, we have had consent. They know that we're going to be using these images for the webinar. However, they have not consented for anybody else to take screenshots and share these on their social media. So please just be mindful. Please don't take any screenshots and share images of patients unless you've got consent. Thank you. So first one, this was just off one treatment. This was using the ARES AO. So this was straight away. What we did here was dermaplaned and then we microneedled with the ARES at 0.5 millimeters. Second, now this was using the ARES AK, which I mentioned before is amazing for acne scarring. This was 4 treatments, 4 weeks apart at 1 millimeter depth. So this was 16 weeks after. So top photo, bottom photo is 16 weeks after. And this is one of them.
This is one of mine. So this is immediately following treatment using the electroporation. It was a single treatment with ARES AA. You can see those little telltale lumps that she had at Azalea straight away after our treatment. So you can combine it with other things. But you can see really how hydrated and fresh our skin looks afterwards. Again, same thing. So immediately following treatment, using the electroporation, just one treatment. And you can see hopefully afterwards that our skin looked hydrated and plumper and just generally fresher. Then this was under eye treatment. So I just want to say she hasn't got any pigmentation issues, more that she has fake tan issues in the second picture. But it's 15 weeks apart. We were using the 1 knee device at 0.25 millimeters and she did have 3 treatments. So this is scar treatment that I'm in the middle of at the moment. This was after her first treatment. I do apologise for the rubbish before picture. But it was using the 1 knee at 1 millimeter with one treatment with the AK, which is the dermal restructurant. And I think you can see already the scar's getting a little bit shallower. And actually we've had improvement with pigmentation in the scar as well. So she's really pleased, and obviously we're carrying on those treatments, but I do leave it a little bit longer in between just for the tissues to recover then. So I think that's us at the end of our webinar. And again, these are what we hoped to cover, and we hope that we have covered through them. Again, those are the discount codes that we've got for the 1 knee device. So need 25, which is the 25% discount on the 1 knee device with Shop Beautiful, including the box of cartridges and the free gift. ARES 30, which is a 30% discount on the ARES range as well.
I wonder what the free gift is. They haven't told us.
They haven't told us what it is. If you would like to, please follow us on socials. We're on Instagram at Aesthetic Training Rooms, or on Facebook, the Aesthetic Training Rooms, if you would like to. I'm going to stop my screen share and see kind of what questions we've got, if I can get them, because I'm not that great at doing that. Let's have a look. Cost of microdermabrasion cartridges. They are, at the minute, they've been on offer. Generally, they're £150 plus VAT for 10. So you're looking at about £18 a cartridge there. but I'm sure they've been on offer, and obviously they're offering the free pack on it with the
Yeah.
microneedling device. So if you're looking at a new device, obviously that would be worthwhile for you.
Would you use AK or AK for general skin rejuvenation?
Yes, we would
yeah.
use AK. We would do both AK
Yes,
and AK.
Or
It-
AO.
well,
Or A.
for general, it just depends what their concerns are.
Yeah.
So like if their concerns were lines, then I'd use AA. If their concerns were dull skin and it had a bit of pigmentation, then looking at AO. If you were looking at, you know, maybe a little bit, yeah, a bit more moisturizing and things, then AK would be great as well. I don't know where training's done in Northern Ireland, I'm sorry.
We know where it's done in Newcastle.
Have a trip over to Newcastle.
Yeah.
We'd be thrilled to see you
Really
here.
good night out.
Why can't you inject the ARES? Do you want to take that one?
Because it's not CE marked. So it is, they're going through the processes, but at the minute it's not CE marked. So we aren't insured to inject it. So if you want to check with your insurance company, they might say that you're okay too, but without a CE mark, we wouldn't do it.
Can the pen be used for lip augmentation purposes? I don't think so. It's not something I would use it for. The Microneedling pen.
Definitely not, no.
Protocol for how deep the needle should go into the skin to avoid any post-treatment scar residue or skin injury. I don't know if the pen can be used in North America, but you can contact Campermats directly and ask them. How protocol for how deep the needle should go into the skin to avoid any post-treatment scar residue or skin injury. I think you probably need to ask your original trainers about that, to be honest. So generally I don't use it unless it's for scar tissue. I generally wouldn't use the microneedle cartridge above 0.5 because obviously we've got the risk, as you say, of the skin injury. So but you need to go back to your original trainer for that. Does it need recalibrating at all? Don't think so.
I would check the manual. Normally it'll say in there if it does need recalibrating.
It doesn't. No,
doesn't.
How much would you charge per microneedling treatment? I think you have to have a look. It depends on a lot of factors, where you are, what you are, what mesotherapy serum you're using, what microneedling cartridge you're using. For instance, as I say, with these ones, you're looking at about £15–18 per cartridge, plus then how much for the meso solution?
It worked out at about 16.
Yes, so you know, sort of £35–40 before you start. So we have to work out from that, and then obviously who's in your area as well. How many passes on the skin with the microneedling handpiece? Does it depend on depth? Yes, it's the protocol that we gave really is just, it's the suggested protocol from ARES. So yes, it depends on depth, it depends on what you're treating, and it depends on their skin condition as well.
So it was originally 1 dry, and then you put the solution on, and then 2 complete passes, so 3 in total with their protocol.
Can the Microneedling device do the electroporation? No, you need a separate machine for that. You need an electroporation device for that. When it has the CE mark, then will it be safe to inject? Yeah, I mean, they as far as I believe, they have applied for the CE mark, haven't we? And it's say the hyaluronic acid is safe to inject. They're just waiting for that as well. Would you only use 2.5 on the body, never on the face? No, a 2.5 is really too deep for the face, even on scar tissue or anything. Your body's got thicker skin, and it depends on the scar tissue, and even then it would only be on very deep scars as well. I don't think I've ever used 2.5 millimeters on anything, to be honest. So I think that's it. I think we've got most of those. If no one's got any more questions, then we will leave the rest of you to enjoy your evening. Again, if you do want the discount code, it was NEED25 and ARES30. I hope you've all enjoyed it, and I hope it's been useful to you, and we hope to see you again. Thank you so much.
Thanks.
Bye.